Good day, my dear postgraduate students. I would like you people to kindly give me a feedback on what is behind me and in front of you, plus what is passing through our ears. Only 2 minutes, please. The first class is bone marrow aspiration. What should I write? Now, there are two sets of needles. One is called a bone marrow biopsy needle or the Jamshidi needle. It is used for taking the tissue intact. The other two are the aspiration needles, and Sala is one needle that has got a lateral adjustable guard. The needles are all short and stout, and this is called the stillet. This will be removed and the aspiration made. The sites for us to make an aspiration will be anterior superior iliac spine, posterior superior iliac spine, manubrium sterni, vertebrae, and the tibial tuberosity. Please by heart this. Coming to the indications for bone marrow aspiration, they can be divided into absolute indications and relative indications. Absolute will be, without this, I cannot make a diagnosis. Aplastic anemia, megaloblastic anemia, multiple myeloma, ITP. Relative indications will reinforce my diagnosis, such as leukemic infiltrate, iron stores, storage disorders, and metastasis. These are not mandatory. Contraindications whenever the patient is having bleeding disorders. Non-indication or useless will be hemolytic anemias. Biopsy, which I showed you first, will be in the case of metastasis and myelofibrosis. The tissue pattern is made up. This is the procedure from the posterior superior iliac spine, done under local anesthesia. Patient is made comfortable, 2% xylocaine, and the skin is cleansed, after which there is an injection with the bone marrow needle. The bone has got an outer table and an inner table. So what happens is this is the outer table, and below that there is the marrow. After passing through this outer table, there is a sense of giving in or lack of resistance. That means your needle is in the marrow. After which the stillet is removed, the syringe attached, and aspiration made. Advantages of this procedure will be it can be done in a short time, but it must be a sterile procedure. The cellular morphology can be well made out. And in a biopsy, there is a pattern that can be seen. This can be used as a corollary for the blood picture. And it can find out the cause for many a disease and also the response to your treatment. These are the sources for my references. The complications of a bone marrow aspiration will be infections, hematoma formation. Sometimes underlying structures such as the manubrium sterni, there can be the heart and the great vessels. Dry tap is a condition where you do not get any material. In that case, we will have to repeat it. Thank you. We have completed class 1.